Thank you, Doctor. Dr. Sudhakar Naidu Laveti on Tacrolimus 0.1% as an alternative to Loteprednol 0.5% in management of nummular keratitis.
Good morning to all. I am going to present Tacrolimus 0.1% as an alternative to Loteprednol 0.5% in nummular keratitis cases. There is real financial disclosures for the content of this talk. The main motto for my study is a 40-year-old vascular surgeon who came to our hospital with both eyes nummular keratitis, having 636 partial vision in both eyes. We started on Loteprednol 0.5% eye drops, only three times a day.
Team slides are not coming.
Okay. Color change. So the main motto behind my study is 40-year-old vascular surgeon came to our hospital with 636 vision and both eyes nummular keratitis. We started on Loteprednol 0.5% eye drops 3 times a day, and after 2 weeks he came with pain in both eyes and IOP was 35 mm of Hg, and we replaced it with Tacrolimus 0.1% eye ointment 2 times a day for 2 weeks and once a day for 4 weeks, and after 6 weeks his IOP becomes normal and there is a complete resolution of the nummular lesions. In previous studies, they have not compared the Tacrolimus with the Loteprednol eye drops. But there is successful resolution of the symptoms and signs with Tacrolimus 0.03% eye drops. The purpose and methodology. The objective of this study is to assess the efficacy of Tacrolimus 0.1% with Loteprednol 0.5% in nummular keratitis caused by the adenoviral keratoconjunctivitis. This prospective pilot study was done after taking approval from the Institutional Review Board. Total 100 cases of nummular keratitis was included in the study, and they are randomized into Loteprednol group having 48 cases and Tacrolimus 0.1% ointment group 52 cases. And all 100 cases were followed up at an interval of 1 week post randomization for 2 months and later monthly for 6 months, and objectively assessed both symptoms and reduction of clinical signs of keratitis. Inclusion criteria: patients with diagnosed case of nummular keratitis was included in this study, and patients with any signs of epithelial disease or infiltration and pregnant women were excluded from the study. Depending on the symptoms and symptom severity, we graded into 4 grades, and in Tacrolimus group 32 cases had severe photophobia and glare and vision, 20 cases has moderate glare and vision, moderate glare with vision loss, and 10 moderate vision with loss. And after treatment, almost 42 cases there is complete resolution of the signs and symptoms. Only 10 cases had mild photophobia. In Loteprednol group, 25 cases present with severe photophobia and vision loss, and 23 cases has moderate glare with vision loss. And after treatment, 34 cases are symptom free and 14 cases had mild photophobia. And we did the chi-square test, and statistical values are significant between the two groups. And these are the pre and post treatment pictures of the Tacrolimus group, and there is complete resolution of the nummular lesions after successful treatment after 6 weeks of therapy. Coming to results and conclusion, among the 42 cases in the 52 cases in the Tacrolimus group, 1 case was intolerant to Tacrolimus and we shifted on to Loteprednol, and 1 case had recurrence. In 48 of Loteprednol group, and 7 cases had recurrent and 2 cases had rise in IOP, and we shifted them to Tacrolimus group. So coming to conclusion, Tacrolimus 0.1% eye ointment is used as a safe and alternative to steroids like Loteprednol in the management of nummular keratitis, and this is useful especially in patients with steroid responders, but further larger studies are required to validate our results. These are my references. Thank you.
Did you include those 7 cases in this analysis? The cases of Loteprednol recurrence and IOP increase, were they included in the analysis?
No, not included. And shifted them to Tacrolimus, not included in them. 6 months, sir.
You are getting.
Yes, sir.
Those were your cases from your institute or referral cases?
Our institute only, sir.
You don't start on early steroid for all those cases.
Okay.
If you start on early steroid, you may not get so many nummular keratitis. What I mean.
They presented with nummular keratitis only, sir.